University Health's brand new women's and children's hospital. It's close to opening, and it really can be a game changer for so many families in and around our area.
That's why joining us in today's leading essay segment is Irene Sandate, is the Chief Nursing Officer of the new Women's and Children's Hospital at University Health. Good morning. Thank you so much for joining us this morning.
Good morning. Thank you so much for having me.
So right off the bat, what was the need for this new facility?
We knew that we were outgrowing our current spaces some time ago. This project has been under development for several years now. University Health has an expansive ambulatory network, many clinics out in our community to serve the citizens of Bexar County and San Antonio. We saw substantial growth in the number of women seeking prenatal care with us. In addition to serving San Antonio, we also serve the region as well. And so with the projected growth of San Antonio over the next decade, and also in our attempt to create better spaces for moms to connect with their babies or families to stay connected with their children that were hospitalized, our leadership made a great decision several years ago to embark on this project. And it's a beautiful building for San Antonio.
So what kind of impact will this make for our community, and how much did our community really need it?
We felt the community really needed a space, a hospital that had all the services needed, from a normal delivery to a complex delivery as well. And we had all those services. We're continuing to refine and grow those services currently. We needed to put all those services under one roof. The reason that's important is because even if you're having a normal delivery, we're that place. If you're having a complex delivery, we're also that facility. We have all of the experts in our affiliation with UT Health. We're also a level 4 maternal and neonatal facility that is the highest level of care designated by the state. And we're also the region's only level 1 PD trauma center. And so we're important to the community for access. If you're having a difficult time, your child is having a difficult time, a complex pregnancy, for instance, your child may have been injured through a traumatic event. And our services provide everything that our community needs. That's our mission. And we know that this facility, having all services under one roof, is really going to be a game changer for the citizens of San Antonio and Bexar County.
And speaking of those services, I mean, you talked about it a little bit, but what really does this mean for children, mothers, neonatal care in our area, especially as it pertains to the new Mother's Place?
Mother's Place is unique. I've worked in many hospitals, and I've always wanted to see something very similar in a hospital where a woman can walk in and pump if she's visiting the building. If she wants to pump her breast milk, there are 2 exclusive and private breastfeeding rooms or nursing mother suites. Also, mother's milk is medicine for a preterm infant, for any infant. But in particular for premature infants, we need those mothers that have a baby in the NICU to be able to pump and store their breast milk and never feel as if they're running out of space. So Mother's Place is a place where they can store any amount of breast milk. We'll freeze it for them. We'll also label it and match it up with their own baby. And this is where we also work a lot of miracles with breast milk in adjusting the amount of nutrition that a premature baby needs to continue to grow. And we call that precision medicine, or making the breast milk more nutritious for that preterm infant that needs to grow substantially and in order to be able to go home.
So what makes this hospital truly state-of-the-art?
There's a lot of technology embedded in that. We are one of the most wired hospitals or health systems in the United States. And there's a lot of safety that comes with that. And in addition to that, we have many ways to monitor pregnancies or an unborn child in our women's areas. We also have a 24/7, 365 women's urgent care. A woman with a gynecologic and obstetric issue can stop by regardless of time of day, regardless of day of the week. That provides access, and there's a lot of technology built in there so that everything that that woman needs can be performed in that area. She can either be admitted or she can go back home. And one other thing that we have done is the neonatal intensive care unit, in addition to providing cardiovascular and respiratory monitoring, women can log in from home, and there's a digital camera at their baby's bedside through a private account that we provide access to. She can create her own account, log in anytime if she's at work or at home while she's pumping, and connect with her baby in that way as well. She can also share that with other family members. So families can stay connected regardless of distance. And also our single patient room NICU will provide the ability for families to be able to spend the night and become essential members of their own healthcare team. This is extremely important to preterm infants, to sick children, and also to women. Women need to understand that there could be complications in the postpartum period. It doesn't always happen inside the hospital. And we have to provide a lot of education to get them ready to identify those issues and come in quickly if that's the case.
All right, Irene, thank you so much for joining us this morning. Anyone who missed any of the interview, wants to watch it more, it's going to be on ksat.com through the morning. And of course, Courtney Friedman got an inside look at the new hospital. That is also on ksat.com.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.